With that, the chair now recognizes the gentlelady from Michigan, Ms. Tlaib, for 5 minutes.
Thank you, Mr. Chair. As a good colleague that I am, Congresswoman Sylvia Garcia had a question. I'm going to ask all of you yes or no, since we have a cutoff. But Mr. Brooks, do you believe affordability is a hoax? Yes or no?
Well, it definitely
Yes or no?
exists. It exists. I've seen it happen.
Okay, Mr. O'Leary. Is affordability a hoax? Is it a hoax, affordability? Is it a hoax? Yeah, we know somebody that keeps saying that.
No.
Okay. How about you, Mr. Moore?
Affordability is higher now. Affordability is higher now than any time in the history of the United States.
Yeah, Dr. Hamilton?
It's not a hoax.
Okay. I also like to bring in my district. Detroit just passed the RX program. It's an incredible program where it's cash assistance to new mothers in our community. And combating poverty in our country has been really challenging. It's been kind of bizarre to understand, but the more I'm here, I understand that, studies by Harvard, for instance, says 65% of working age renter households struggle to pay for basic necessities after paying their rent. It just keeps going up. It's not even going down. I mean, study after study. So, Dr. Hamilton, do you see a role in direct assistance in providing financial stability, addressing affordability crisis, and promoting what you call authentic freedom?
Yes, it's power. Those studies, those interventions and the studies that accompany those interventions demonstrate that people were able to do a lot more from the simple intervention of cash.
I sat down with homeless youth, and that's what they told us. We understand you want to give us housing and everything, but we also we need to go to work. We need gas money, all these kinds of things. My economic dignity for all agenda encompasses the baby bonus, the child allowance, a monthly payment to adults that builds on such research that Harvard was talking about in regards to cash assistance being more impactful. And so, zooming out, Dr. Hamilton, you noted that in your outcomes that you see today, including affordability crisis and massive inequality, are a result of concentrated economic and political power. And that's what I feel like my colleagues don't have the courage to take on. And so I recently introduced a resolution calling on Congress to end the political economic dominance of the wealthy few, halt the subsidiaries and the tax advantages that concentrate economic power, and reinvest in the needs of the American people. So, Dr. Hamilton, if we are really serious about addressing concentrated economic power, the affordability crisis, how would you think differently about public policy? And what policies, like taxing the rich, which is incredibly popular across the board, go ahead and poll all kinds of districts. They will tell you to tax the rich. Rebuilding labor movement, breaking up monopolies and promoting democratic forms of ownership to displace corporate power. Should we prioritize in thinking about those kinds of policy?
I mean, we obviously need to facilitate the collective right to bargain, the ability for labor to formulate and be able to negotiate the conditions of their workplace. That's a good place to start. The taxing the rich not only offers additional public resources, it curtails some of that political power.
Yeah, it's fairness too. I mean, most of the people we want to tax, we're subsidizing their workers' health insurance, food assistance. I mean, it's kind of like this game of you're not going to pay your workers enough, but the public is going to give you you're going to pay less in taxes, we're going to give you tax breaks and giveaways. And by the way, we'll cover the health insurance and food assistance programs that your workers need to survive.
And if I may, I'll say something, and I'll try to be brief. I know this doesn't get said in this room a lot. We need inclusive economic rights.
That's right.
We talk about political rights, civil rights, social rights, cultural rights, but at the end of the day, if you don't have a baseline level of resource, you're not able to engage in a transaction. You're either at the whim of somebody's charitable regress or the vulnerability of their exploitation.
It's exhausting. It's like survivor mode. Yep. It's crumbs.
So what we're talking about when we talk about guaranteed income, when we're talking about baby bonds, when we're talking about Medicare for all, it's simply a baseline level of resource so that people will have the ability to compete and engage.
I mean, my colleagues easily press the button for tax breaks for the wealthy, the corporations, but they don't seem to want to do it for our families. And I mean it. I'm not saying this as some sort of gimmick. I really believe this is the only way we can combat affordability crisis, poverty. And Dr. Hamilton, I would love your opinion on my Public Banking Act. public banking is something that I think we need to really explore. North Dakota is a great example, but keep writing about it. Keep, trying to push, again, the fact that we need public banking in our country.
Have at it with
Time has
markets, as
expired.
long as people have a
Gentlelady's time
baseline
has
level in
expired.
which to
I
engage.
agree.
Thank you, Doctor. Gentlelady's time has expired. The gentleman from Florida.